Alabama has one of the worst maternity mortality rates in the country, and Black women are at an even greater risk. We're coming off the heels of Black Maternal Health Week and closing out National Minority Health Month, bringing awareness to some of the stigmas associated with this crisis. According to the Alabama Department of Public Health, Black mothers in Alabama are more than twice as likely to die during and after childbirth compared to white mothers. The Milken Institute's 2023 report reveals the mortality rate for Black mothers in Alabama is 100 deaths per 100,000 live births, significantly higher than the state's overall average and higher than the national rate for Black women. This Wellness Wednesday, we hear from medical and mental health professionals on how to move the needle, and one woman who shares her own personal experience of motherhood as a Black woman.
I had a very difficult pregnancy, unfortunately. Being somebody who worked in the fitness industry, I was always moving prior to pregnancy. I knew my body very well, but when I was presenting the different issues like the pain, the inability to eat to my providers, everybody just brushed it off. Like, this is part of the process, you'll be okay.
This is more common for women like perinatal exercise specialist Jasmine Mitchell. Dr. Shawnita Seeley-Jefferson, an epidemiologist with Ohio State University, says it's important for healthcare providers to listen to their patients.
I think that they first should learn about structural racism if they aren't already familiar, and how it can and often does show up in the healthcare encounter. They should advocate for Black women to be heard and respected.
Mental health plays a role in this crisis. Huntsville psychotherapist Monretta Vega says providers must work to help build trust with Black women.
Building trust with an African-American female after she's had a negative experience is really going to be about exposure therapy and creating that safe space for that female, being able to provide her with confidence that you can be trusted as a therapist or as a provider, but then hearing her, seeing her, allowing her to be vulnerable without judgment.
Mitchell also believes healthcare providers should work together. She's working to change that narrative by hosting her most recent event this year, Birth to Bounce Back.
The resources, all the resource providers, all the birth workers, all the people who specialize in postpartum, especially when we're talking about people of color, making sure they're all there in one space, not just meeting mothers in that perinatal field, in that perinatal time period, but also that the providers are connecting with one another.